in association with big societies, so that more people are reached with this, more doctors across specialties. An allergy conference which includes not just pulmonologists but also different allergists, immunologists, ENT specialists, pediatricians, gastroenterologists, so on and so forth, because it's a multi-system disease. So I welcome Dr. Vishnu Rao sir to talk about today's ideas program, because he has been practicing since the last 30 years. His journey began in Miryalaguda, and he had been treating infants, children, has seen allergies starting in that age itself. As we all know, allergy is known to progress in the form of allergic march. So that is where it starts, and eventually it grows along with the child. And this allergy is growing in different forms like rhinitis, sinusitis, asthma, eye allergies, skin allergies, atopic dermatitis. We have seen the severe most forms of atopic dermatitis, which can be treated not just with topical medicines or allergy tablets, but also with probiotics, specific ones, especially after doing the gut lung check, which is checking the gut microbiome. So all these things, I welcome Dr. Vishnu Rao to come and discuss and share his rich clinical experience of the last 30 years about allergy. Thank you.
I practiced there for 1 year. After passing out from the Nilofer hospital, I go to a mandal level, grassroots level. There, a different experience. Like what we learn in the institute among professor and assistant professors, along with the postgraduates, when we enter into the real field, then you know the pinch of the problem. So you are alone there, and they come with the multiple problems. So there I encountered with most common respiratory problem as allergy and wheezing. At that time there was no nebulizer. In 90s, 91, there is no nebulizer. We have not yet seen the nebulizer. Those were the days. We only studied in the theory. From there, I used to refer the cases to higher centers as far as this allergy, this severe asthma is concerned, which attracted my attention because sleepless nights, parental anxiety, and so much of psychology is involved in this problem. So then I come to Miryalaguda. There, gradually my attention goes to the allergic diseases in childhood. Then I started a clinical observational study on 6,000 students. What exactly these children are using? What is the right treatment, inhaler treatment or fish medicine, at that time very rampant, and what are the conventional drugs they are using? Out of that 6,000 children, what I observed, I presented at the National Pulmonology Conference in Coimbatore, where I got a Young Scientist Award for that clinical presentation. That is says only less than 2% of the children are getting the right treatment for asthma. Right treatment, right meter, like a lock and key. So asthma means everybody uses Asthalin inhaler. That is not the right treatment. So that 90% people may be using it. That is not the right treatment. Then conventional drugs 90% and 7 to 8% people are using fish medicine and all those things. And after those taking that, the suffering is there, what I identified, and the solution is there. Suffering is there, solution is there in the form of the drugs. The connecting link between the suffering and solution is missing. That is asthma education, which I take up. At that time, right to breathe equal. In 98, there is a call coming from the WHO, right to breathe equal. Everybody has a right to breathe equally. That actually attracted my attention. Then I totally involved into the pediatric allergy. I traveled along with the disease into the adults one. Then I came to Hyderabad in 2004 after practicing 12 years in Miryalaguda. Then I joined in DNB and pulmonology out of my interest at the age of 44. Then only to see how this disease is going, traveling through 0 to 100 years. That was my interest. So in that juncture, I traveled as a pediatrician. So I've seen the nose manifestations, ear manifestations, skin manifestations, lung manifestations, GIT manifestations, and the similar thing in the adult life also. So I thought that when I am connecting with these organs and everything, then I thought subsequently, okay, it is better to have a platform where all the specialists comes under one platform. Then I developed a interdisciplinary interactive allergy solutions or innovative allergy solutions or interventional allergy solutions in the form of allergies operations also sometimes. So this is the thing. Since allergy, as Dr. Vivek told, is the most commonest problem in the humanity, one, every 1 in 3 people are suffering with one or other allergy, whether it's eye allergy or nose allergy or skin allergy or lung allergy, otherwise known as asthma, or gastrointestinal allergy, whatever, neurology, migraines or neuroallergies. So these are all the things. So then I thought allergy is no longer a condition confined to one organ, one specialty. It is a chameleon appearing in the skin, lungs, gut, eyes, even nervous system, in the joints, and so many sites. Allergy is no man's specialty. Here is the big thing. Allergy is a no man's specialty. It crosses the borders because the human being holds all the systems within. So it is not separate. So it is every specialist's responsibility. Ideas is unified platform where specialties converge and insights are shared, and the collaborative care becomes the standard for the patient. Let us move from the isolated interventions to integrated intelligence. So, and breathe new life into how we understand allergy, how we diagnose allergy, how we manage allergic diseases. Why ideas? So this is allergies don't follow departmental boundaries. They don't know. They cross all the systems. Share, but trigger is same. Either pollen or dust mites or foods or infections, whatever. The pathways are the same, linking all the organs. Ideas brings here together to listen, understand, and act, ensuring patients are not treated in isolated fragments. So the problem, fragmented care and siloed systems. Suppose ENT is different, lung is different, skin is different, and gastrointestinal they are siloed. Yavariki vare yamuna tire. So we are involving in our own specialty and we are not sharing the data. If you don't share the data, what is happening we don't know. So this is that leads to delayed diagnosis, duplicated tests, and missed root cause become common when organs are treated in isolation. So outcomes suffer while systems remain siloed. When they are isolated, the patient will suffer. So allergic diseases demand collaboration. Allergic diseases, that doesn't mean that only ENT. Allergic disease doesn't mean that only lung. It doesn't mean that only skin. It doesn't mean that only GIT. Allergy is the underlying immunological disorder where all organs are connected. So these are the things. In the center, the patient is there, fragmented care and siloed systems. So all the systems, the patient is connected to all the systems at a time. I have seen multiple patients since 30 years. The patient having allergic conjunctivitis, allergic rhinitis, infantile eczema, and at the same time asthma. We call it as an allergic march. It starts in the nose, ends in the lungs as asthma. So this is what I followed through my since 30 years of this thing. The vision, integrated, personalized, collaborative. So team-based, patient-centered models replace isolated care, ensuring every aspect of patient's condition is addressed. Focus on immune-informed diagnosis. Immunology is the crucial factor. So that is the most important. So prevention first thinking, precision therapy tailored to individual boundaries dissolve and knowledge flows. So when all the systems comes together, these boundaries will dissolve and the knowledge will flows. We aim to heal whole person. That is the most important, not just treat separate parts. We cannot piecemeal the patient. Is the patient is one as a whole person. We have to treat the person there, not only the disease, because even the disease carries the psychological burden also, and we have to even address that also. So this is my intention from the beginning. So this is the vision: integrated, personalized, collaborative care. This is the approach. So connecting specialists to solve the puzzle. Every specialist is holding their own piece of puzzle. They only see that puzzle. But when you integrate all these puzzles, then you get the grand picture. Just like there is a story, some blind people see the elephant. Some says, only legs, how they describe each part. But when they see a bird's eye view, oh, this is elephant, then they get surprised. Just like that, allergy విశ్వరూపాన్ని చూశాను నేను. ఎలర్జీ యొక్క విశ్వరూపం. Once upon a time, on our times, if you know syphilis, you know medicine. Now, 10 years are this thing, if you know diabetes, you know medicine. Now, I am very confidently say, if you know allergy, you know medicine. So this is the present trend going in the world, because allergy is rising along with the pollution and everything. So connecting specialists to solve the puzzle is very, very important. So multidisciplinary network, a unified platform connecting 9 key specialties: ENT, pulmonology, dermatology, pediatrics, gastroenterology, neurology, ophthalmology, immunology and general practice, and rheumatology also, and psychiatry also, and psychology. There are so many other things are there. So this is all the things. So network, tools and innovations are improved. This is the approach, connecting all the specialists through immune network. Immunology is the number one. Unfortunately in India, there is no degree on immunology. Recently they are introducing at the VIP Chess Center, if at all any degrees are more, it should be allergy. Allergy degree should be more actually, but there is no degree, because there is no understanding of allergy in this anywhere in the world. Because the person who suffers with allergy, sneezing, what is their sneezing? If you ask that person, sir, it is better to die rather than sneeze every day, they only know what is the suffering. Because the allergies and asthma patient, they look normal outside and everybody take it for granted what is there. But it is a very big subject actually. If you explore it, then you see the Vishwarupa of the allergy. So ideas: integrated immune platform, connecting multidisciplinary specialists to solve the immune puzzle. So this is first pediatrics. As a pediatrician, to start with, I have seen all the cases, mostly allergy. Then I followed the pediatric. Then where allergy often present first is the nose. First, when this allergic rhinitis begins, a 3 months old child, who is the first person to diagnose is the mother. It is not the doctor. It is the mother. If you go very deep into the history, it is the mother. It is never the doctor. Mother come and says, sir, in the night, I find my child is not breathing properly through something is happening somewhere in the nose. Something is wrong. Then if they present to young physician, not to experienced, then they play very well in front of in the clinic chamber. Why you are so anxious? You are young mother, you don't know anything. So this is common. Then she don't know to whom to share. These are all the things which makes you to think. While she is taking the breastfeeding, she leave the breast and take for some time, and again she takes the breath. So along with other diseases also, there are cardiac diseases which cause this, but allergy is the most common one. There, some rash will appear here on the cheeks as an infantile eczema, on the here and here. in the back and the flexor areas. If you see the entire area clearly, then you understand some allergy process is undergoing. Allergy means discomfort. Allergy means disturbance. That disturbance first identified the mother, not by the doctor. So across allergy specialties, but care often remains fragmented. Patients bounce between the ENT, pulmonology, dermatology, and other people. This mother goes to many doctors when the problem is not solved. When this young doctor says, no, this is okay. No, this doctor is not able to understand my child problem. Let me go to ENT doctor. Then they go to ENT. And then suddenly they go to the dermatology also. They go to pulmonology for asthma. So they keep on shopping every specialty. So what is the solution for this? The ideas, interdisciplinarity, interactive allergy solutions provides a platform to connect specialties. Suppose there are all specialties are sitting here. As a pediatrician I am talking, or an ENT surgeon I am talking, my perspective, my area, then other doctors will be connected to that. So provides platform to connecting specialties, shared insights, coordinated care. We bring ENT into active collaboration with pediatrics, pulmonology, dermatology, and immunology for shared and comprehensive view. So these are the ENT is often the first point of contact for allergic patients. With ideas, you don't just treat the nose, you help heal the whole person by addressing the root of the inflammation. The allergic inflammation is the root. This is called inflamed. This is how it looks. Inflammation means inflammation. Flame is there in that. Flame. Jwala. Yantaki arani jwala. Allergy, then atla define chestan. Yantaki swasalo yantaki arani jwala. The fire in the breath. I define it as the fire, the continuous fire in the breath, which goes from nose down to the lungs. This fire involves, this kind of fire will disturb the person. Then nerves are there. So neuroinflammation, they present as a headaches. And migraine, we brand it as migraine. The patient goes to neurologist and they get all kinds of CT scans and everything, forgetting about the immunology. Until unless you treat the root cause, nobody can treat it. So many patients are there like that. So this program mainly I intended for the postgraduates and the young doctors, not the doctors who are already there, who are very experienced, they know everything. But this is my idea which I am sharing to the young doctors. So that when they come into the practice, they look in the whole perspective rather than the siloed systems. So this is the dermatology again. So skin as the first messenger. Infantile eczema may be the first presentation of allergy 3 months old. This rash, then you have to think some allergic process is going in the body and we have to alert the parents. You have to continue the breastfeeding. Don't give top feeds. These kind of things. This is the forerunner of asthma. So you have to be careful as far as indoor pollutions are concerned. Like agarbatti or perfumes or dust mites or everything. We have to warn that parents. Be careful. This may convert into asthma later. This can go to nose problem. This can go to ear problem. This can go to throat problem. And later it may end up with snoring also. So one skin, that is the point we have to, these are the very subtle pointers. So pointing towards this thing. These are the allergy. This may appear superficially, but at the depth, there is something else. Like this is only tip of the iceberg. So pulmonology, breathing allergy burden, asthma, cough variant asthma, recurrent cough, allergic bronchitis, chronic wheezing, exercise, so many names are there, but underlying is only thing immunology. So respiratory allergies rarely exist in isolation. They don't present just like asthma, no. They already have allergic rhinitis. They may be having skin problems. They may be having eye problems. They may be having migraine problems. So many problems. They often stem from or coexist with ENT, skin, gut issues, and trigger like pollens and dust mites are shared across systems. United airway disease, which I am practicing. United, one airway, one disease. One airway, one disease. This is my concept of treating the patients. So we coordinate trigger control, immunotherapy considerations, comorbidity management by linking pulmonology, ENT, all these things. Now, this above is the nose and below is the acidity, gastrointestinal presentation. One of the presentation is acidity in allergy. Some patients always belchings, bloatings, and IBS kind thing. After eating something, they get disturbed. Upper is the this one and lower is the acidity. In the middle sandwich is the lungs. Lungs are sandwiched. If you treat only asthma, forgetting about the fixing nose and acidity, you are giving incomplete treatment. They never get better. So at the same time, you have to fix the sneeze and treat the wheeze. You have to fix, at the same time, you have to fix the acidity also. Any other problems also, you have to fix it. If you don't understand by yourself, you have to refer the patient or you have to take the inputs from the other specialties. But finally, we have to do justice to the patient. That is the motto. So these are the normal lungs, these are the inflamed lungs. That flame, that was I was explaining. This is the flame, continuous flame, that is called chronic allergic inflammation in the breathing tubes is asthma. This will be there for lifetime if you don't treat. And these patients want to die every day. If you ask them questions, if anybody come and sit in my clinic, they will cry when I explore the patients. సార్ ఎందుకు సార్ ఈ బతుకు ఒక్కసారి పోతే బాగుండు కొన్ని వందల మంది కొన్ని వేల సార్లు అంటుంటారు బట్ దే లుక్ నార్మల్ అవుట్ సైడ్ ద ఇంటెన్సిటీ ఆఫ్ ద ప్రాబ్లం nobody understands. If you understand, then it will be something different as far as treatment is concerned and management is concerned. So gastroenterology, this is the biggest storehouse of immunity. 70% of immune cells are posted in the gastroenterology area here, and rest of the things are throughout the body. 20% here nose, adenoids, tonsils, and these are the stations where immune cells, security officers are placed. These are all the security system of the body. So this gastroenterology, suppose this how this they teach the tolerance. They teach tolerance to the immune cells. Who teach? Suppose we are there in the immune classroom. Suppose gastroenterology is like an immune classroom. There is a teacher who is the microbiome and immune cells are the students. Suppose if teacher is good, they teach the students how to be tolerant. So what to react, how to respond, they will teach. If the teacher himself spoiled by the food, the microbiome is the bacteria, which is called good bacteria. When the baby comes through the mother's birth canal, then actually this bacteria is engulfed by the baby. They take all the secretions into this. That is the seeding of the bacteria. Within few days, that goes to millions and billions and trillions, this bacteria. When mother feeds, these bacteria felt very happy. They are the good bacteria. That is called good microbiome. The same baby, if you feed, if the top feeds, then it become a bad bacteria will develop that. That is dysbiosis. So suppose this microbiome is like a teacher, then he will teach the immune system to the immune cells how to be tolerant. If teacher himself is disturbed, students also get disturbed, and this enters into all other systems, into the lungs, into the skin, into the nose. So now the root of all allergy lies in the intestines. So that is the thing where we have to address these problems. So eosinophilic esophagitis. Patients comes, సార్ నేను తింటుంటా నాకు ఏదో పట్టేసినట్టు ఉంటుంది సార్ ఇక్కడ. I'm not able to, something is there, I can't swallow it properly. Same allergy patient, may be suffering with asthma, allergic rhinitis, and this one, and this also. So eosinophilic esophagitis, that is inflamed esophagus. When the food goes through them, how he feels, they only know. We don't know how they feel. But we have to address that feeling. That is more important. So this is the gastrogut. Gut is the allergy equation. Food allergies, all these things affect the gastrointestinal system. So neuropsychiatry, allergic migraines, neuroinflammatory signs, fatigue, cognitive fatigue, sinus related headaches, sleep disturbance, behavioral changes, everything. Mind is not separate from the body. Body is not separate from the mind. Both are. When the allergy is there, this person become irritated. Suddenly the aparichitudu come from you. Just a minute before you will be normal. Suddenly they exposed to some kind of dust or something. Suddenly they get irritated, they get headaches, they get so many sneezings and watering of eyes. If you talk to that fellow, this behavior is linked to the disease. We brand that person in so many ways as we wish. But actually, who is making all this? The villain is inside problem. We have to address that problem. So because this leads to so many asthma patients are referred to psychiatric. సార్ నాకు మెంటల్ ఉందంటారు సార్ అందరూ. నా బాధ అర్థం చేసుకోరు సార్. నాకు కోపం వస్తుంది, ఈ బాధ ఎందుకు అనిపిస్తుంది, ఒక్కసారి చచ్చిపోతే బాగుంటుంది అనిపిస్తుంది. ఓ నీకు చచ్చిపోతే బాగుంటుంది అనిపిస్తుందా? ఓ యూ హ్యావ్ ఎ సూసైడల్ టెండెన్సీ. ఓకే, లెట్ us bring to the psychiatric. The problem is maybe asthma, untreated, unidentified allergies inside. So that is the thing I wanted to say. So when the mind fog, allergy ఉన్న వాళ్ళకి అసలు ఏమి క్లారిటీ ఉండదు. If you see through a mist is there on the mirror, you can't see your image clearly. They are like that. They are not clear. So if you clear that, if you treat that allergy, they will be alert and active. So that is the thing. So ophthalmology, when allergy speaks through the eyes, okay, red eye is there. That means ophthalmologist should know that if he is there, as ophthalmologist is there, if he listen to entire this thing, then he will know that, oh, all other systems also are involved. No, I have to do the immune work for these patients. Then I have to address whether he is having asthma or rhinitis or skin disease. No, I don't bother anything. I want to see only my eyes. That's all. Then you can't be somebody who is doing justice to the patient, definitely. Either you have to refer, either you have to get the inputs. So this is the main idea behind the ideas. So this is the, if you treat only this thing symptomatically and you leave behind the asthma and other things, it is incomplete treatment for the patient. So immunology, this is the master here. So unifying the immune lens across the systems, how security system sees when you enter into the airport, they scan everything. Just like that, now immune lens, Ig mediated hypersensitivity, mast cell activated, these are the root causes to identify the root problem. So we make immunology the connective tissue informing diagnosis, prevention, personalized therapy. Ideas enables root cause thinking, component diagnostics, and prevention focused models based on the comprehensive immune profiling. So immunology is very, very important. See, the causes may be the food, the causes is microbiome, the cause may be pollution, they are the root causes. They are the root causes. Our lifestyles are the root causes. When you are with the nature, you will be fine. If you dissociate from the nature, if you keep on taking the junk foods, if you are exposed to polluted environments, if you are subjected to so much of stress, if there is no sleep, so these things leads to this immune dysregulation, which is a stem. And this leads to this enters into different specialities and different subspecialties. The same problem enters into different pediatrics, neurology, psychology, whatever. So all the things. So these are all the specialities. Treat the root, not the fruit, is the thing which I coined for this program as a logo, as a tagline. So types of immune cells and their origins. When you say white blood cells to the students, they think that what white blood cells. Actually, they are the immune cells. They are the immune cells. So neutrophils, eosinophils, monocytes, these are all the myeloid lineage and lymphoid. It is like a bone marrow is like a university where red blood cells and white blood cells, they bond there. And some of the white blood cells are trained there and matured there, and they go to the function. And some of the cells we call T lymphocytes, immature cells, they go to thymus. They send for the specialized training for the thymus. There they trained it so well that CD4 lymphocytes, CD8 and natural killer cells. So they are so much trained, these cells. So B cell, if dust mite is presented to this one helper T cell, which is actually zero, actually it's a naive cell. If some dust mite came, this become a plasma cell and that releases IgE antibodies. If the same thing is exposed to bacteria, this is releases some other kinds of chemical messengers. That is type 1 immunity. Type 1 immunity is the immunity where our forefathers used to have. Now the present generation is type 2 immunity. అంటే ఒక విధంగా చెప్పాలంటే ఇమ్యూనిటీ గురించి ఒకప్పుడు ఓల్డ్ జనరేషన్ అంతా నాటుకోళ్ళు, ఇప్పుడు ఉన్నాయన్నీ ఫామ్ కోళ్ళు. దే ఆర్ సో సెన్సిటివ్ because of food habits and exposed environments are different. So this is the, so Th1 immunity, type 1 and type 2, and this is protective immunity which comes through the immunotherapy. This is what we are doing, immunotherapy. So this is, now the general practitioner is exposed to all kinds of people. He see all people. So this is the allergy symposium we are going to conduct in 2026, associated with the big bodies like pediatrics and general medicine or whatever it is. So every specialty should be exposed to a platform, interdisciplinary, interactive or innovative allergy solutions. So this is the thing. So from isolated interventions to integrated intelligence, let this be the beginning of new era where boundaries between specialties dissolve in the service of a common cause. What is the common cause? Common cause is the betterment of the patient care. Whatever you do, the final result is the patient welfare. Whether you do homeopathy, Ayurveda or allopathy, or you treat whatever it is, what is your final aim is to restore the patient's health and well-being, both mind and body. That should be the idea. So treat the root, not the fruit. Gastroenterology, I put it, roots. Immunology, then dermatology, then pediatrics, then ENT, then pulmonology, psychiatry, neural. See, this is one. So all these things it goes. So allergy is a systemic immune dialogue. Ideas unites us to listen, to interpret, and to correct the dialogue together. Together. We have to do it together. This is what? Why you do what you do. Why you do what you do is the big question. What you do is similar. What you do, if you ask somebody, what you ask first, what you do? What you do. When you ask why you do, then the person thinks, why I am doing this? What gives satisfaction to me? Why you do? Because whatever you do in the early morning, if you get up from the bed, yes, I am doing for the good cause. If you feel that, that is your real purpose in the life. That really I connected to this allergy so much. Even today, I sit as a practitioner. I am doing the first day of my practice. Today only I started my practice. With that much of enthusiasm, I involve in the allergy care. That's why people don't understand me. Vishnu Rao treat nose, Vishnu Rao treat eyes, Vishnu Rao treat that, Vishnu Rao treat this. No, I am treating allergy. I am treating allergy. So I am treating the person. So how you do is more important. How you do is unique for every individual in this world. What you do, how you do is unique. Vishnu Rao maybe do it differently. Vijay Kumar do it differently. So that is how we differentiate person to person. What you do is a common thing. Why you are doing do gives always satisfaction. How you do is the method. What method you follow. So like that. So in the police language, if we talk, there is East Zone, West Zone, South Zone, and North Zone in Hyderabad. No, East Zone issues I don't bother. No. Hyderabad is a single unit. And definitely departmental discussions must be there for you. So whatever is there. So just like that, interspeciality discussions must be there to address there the security of the Hyderabad, here the welfare of the patient. So this is what I want to say. So on behalf of Shwasa Foundation, these are the Panchabhutas, which I am very much passionate, Panchabhutas. These are the green lungs. Actually, this is my logo for Shwasa Foundation. So thank you for coming together, all the specialties. Thank you so much.
Shirisha Raghavendra, IPS, is the special invitee. Please come for the lamp lighting. So all these biologics were also given to this kid just to treat the atopic dermatitis. And eventually the patient was also put on immunotherapy, which is Sensimune, which is specifically targeting these dust mites. So still the patient continued to have symptoms. Then he happened to be my friend's nephew. So I saw him at my hospital, and then we have advised a gut microbiome testing for that patient, which showed significant dysbiosis, especially deficiency of Ackermann's bacteria, which is very crucial for maintaining the gut uh, and respiratory health. So this bacteria was quite deficient in the child, and also other bacteria like fusobacterium and other things were in excess. So this kid was started specifically on probiotics, which is metabolic daily, which contains these particular Ackermann's bacteria, and it's been 6 months. He's off biologics. He's just using antihistamines and is on topical steroids and also tacrolimus and doing very well. The feeling the patient had when he was suffering, he had tried to commit suicide twice. It may be a small thing for us when the patient comes to us, but he tried to commit suicide twice because of the severity of the itching and also nasal allergy. I forgot to mention that he had nasal allergy as well. So this is what Dr. Vishnu sir is speaking about. This is the amount of agony that the patient goes through when the person is suffering with allergy. The patient comes to us in our clinic. It's just those 5 minutes for us, but it is a life that is affected of the patient. So this is how that patient felt. One more example is one more case that we had a case of severe eye allergy, and this boy continued to itch his eyes so much that he eventually developed keratoconus, where there is herniation of the cornea. So that is the level of allergy he had. When we did immunocap assay for this patient, he had a high allergy to dust mites, DP and DF. Initially put on topical steroids and also antihistamines, orals, and then eventually put on immunotherapy. It's been almost 2 years and he's doing really well with single antihistamine eye drop. So this keratoconus is a very dangerous condition. If we leave that condition, this allergy like that, that will cause even blindness to the kid in future. So this is the level of impact the right diagnosis can have on allergy patient's life. This is what Dr. Vishnu sir has been talking about. So multidisciplinary approach is what we want to take forward. Seniors, everyone knows this, but this is the message that we want to give to the youngsters who are about to enter this allergy system, because the prevalence of allergy is not the same 20 years back what it was. It is different now. So this is the practical examples I would like to share, and I thank each specialist for coming here.
Thank you for coming, and I want to, we forgot one thing to tell. Now I want to dignitaries to share the dais to talk about the ideas. I invite Dr. Bhaskar about this, how he is feeling about this one, being a pediatrician, senior pediatrician, and we used to work together in Nilofar Hospital. So he is a Lakshmi Children's Hospital owner. I invite him to give his feedback or whatever remarks.
Dignitaries and all the distinguished participants, at the outset, I convey congratulations and greetings from 2,000 members of Pediatric Academy of Telangana State as its president. I am the president for 2025, and after 2-3 days, our Dr. Vijay Kumar will be taking over the superintendent of Nilofar Hospital, who is also here. So when Dr. Vishnu Rao invited me, actually we are busy with some other program at resorts. Today we have one evening very important function. Despite the fact that we are busy, I thought I should come here because the concept is so good, and I know Dr. Vishnu Rao since last 30 years. So he was there, as he already briefed, he was there in Neredcharla, it's a small mandal headquarters. Then he moved to Miryalguda, which is also my hometown. Yeah. So when I heard that he's coming to Hyderabad, I was surprised. What happened to him? He was such a busy practitioner there, seeing hundreds of patients every day. And for a practicing pediatrician, it is always the number counts. How many is seeing? If he's seeing more, he is more respected. So why is he coming? But I knew that he is a very intelligent, genius, well-focused man. So now he came to Hyderabad in 1999. After 25 years, his center, Shwasa, has become a final destiny for the children who are suffering from respiratory allergy disease. So whenever I see patients, they say, sir, I have taken treatment there, here, and also I went to Shwasa. I got relief, but somehow it's not going away. This is the version of very few patients. And most of them, they bring the prescription, sir, we went there and we became all right, now we are so happy, sir. It's extremely good. These are the compliments which he gets, and he is the pioneer in the field of pediatric respiratory allergy diseases. And as he rightly said, if you extrapolate this to the child developmental disorders, neurodevelopmental disorders, even their team works. It's not only the pediatrician, it is the developmental pediatrician, it is the psychologist, it is the audiologist, social worker. So many subspecialties they have to be intertwined to give good results for the child. Similarly, this concept is so good, and this Hyderabad needs 20 or 30 Vishnu Raos to take care of the children who are suffering from respiratory allergies, and not less than 30 interdisciplinary centers wherein, as he rightly said, a pediatrician, a pediatric allergist, ENT, gastroenterologist, chest specialist, of course, pulmonologist, and also psychiatrist, psychologist. So all are required under one roof. Then the child will get, or the patient will get a good treatment. Of course, as we all know, some of them are there lifelong, but we can give them great relief. Ultimately, relief is more important than the cure. Cure for some diseases, but relief is equally important. So we really congratulate Dr. Vishnu Rao for doing this great, commendable job. I am proud to be associated with him since last 30 years. I wish him all the very best, all the success, because he is bringing relief to the sick children. That is very important. So congratulations, and I wish you all a very happy new year.
Thank you so much. Actually, they are very busy with their evening get together, where I'm supposed to go also. They spend Superintendent of Nilofer Hospital and incoming President G. Vijay Kumar. So I invite him. He is my classmate to share few.
College days with Vishnu Rao. How this allergy part. There is one more classmate. His name is Y. Venkateshwar Rao. He is in Khammam now. When we start reading in the room, he's quite all right. Once you go into library, he opens the book and he starts sneezing. You remember, right? And personally, even otherwise, Dr. Vishnu Rao and myself, we are in great touch. We never lost the touch of last over 35 years. But this 25 to 30 minutes lecture by, is it lecture or was your experience actually? He was giving his experience. Yes. I thought he has somebody who does work as passion with interest. This is the result. This is how I feel, not because he is my friend. Of course, he is my friend. But whatever he said in the 25 to 30 minutes, it was his experience and he was speaking his heart. And he has, from his work, he has taken us to something called holistic medicine. Though he said all these specialities, he was combining all that into himself. That is holistic medicine. And also he brought in some philosophy also. I think from now, I will be referring children to Dr. Vishnu Rao. Previously, he did not do that. I think I'm very much convinced to do that. All the very best, Vishnu Rao, and very happy to see Dr. Vivek. I've seen you as a school kid. Now I see after years. Thank you very much.
I'm seeing the ideas of Vishnu Rao. So I'm seeing he's my senior, know him from 1990, and he's very dynamic. I went to his clinic also at Narayanguda. But whatever he is telling, most of the people, pediatrician, they nowadays when we were taught, all these are not there. In 40 years back, they are different now. So everything will be linked to some way of allergy. There is a lot of lifestyle modification, lifestyle changes for last over 40 years. If we see how we reared, how we brought up, and how we are rearing our children, that makes a lot of difference. So definitely, allergy is the major issue nowadays for all the children. I hope Vishnu Rao will address those, and definitely as the incoming president of IAPTC, actually when I elected, he told we should do one activity. Definitely we are going to do with Shwasa and ideas. We will spread the message. Thank you, Vishnu.
Thank you very much, sir. I thank all the dignitaries of the dais and for calling me over here as a treasurer. I have come to know a lot about sir before coming over here. It's a great opportunity to know about you, sir. And as you rightly said, it's a great opportunity to work to give Shwasa to this Shwasa Foundation, so that we will work a lot, so that we will really create so much, unified breath for everyone. Thank you very much, sir. It's a great opportunity to know about you. Even though I know him before Vivek, I know him, but it's really great to come over here to address this gathering and to know a lot about it. And as you rightly said, treat the root, not the fruits. Thank you.
So to continue this legacy, Dr. Vivek entered into this field and he is expanding the hospital to a 50-bedded exclusive respiratory center for both children and adults. And it is first of its kind. It's an exclusive center. In allergy work, immunology work, and ICU and interventions. So he is so much passionate, more than me. He is actually stressing himself because of the patient load and all these things. And we don't know how to address this load since so many patients are pouring with the... Then we realized this is the number one problem in the world. If you rightly connect it to the patient, sir, whatever you are telling in the social media, sir, I have this hyperactive children. When the nose is blocked, the child get irritated and hyperactive. What is the root cause for this hyperactivity? The untreated, unidentified allergies are the root cause for most of 80 to 90% of the hyperactivity. Where I am treating them, they are becoming silent. They are becoming normal. Even in autism also, the allergy is associated. That is why if you change the microbiome in a woman who is not married yet, but who is allergic, from there we have to take the care. From there, before she going to marry, we have to see whether she is having allergy or not. If she is having allergy, that means she is having bad bacteria in the gut. And the same bacteria will be transmitted to the baby also, same immunity. Now the science is developing so fast, we are entering into the gut check and gastroenterology area where the immunity is stationed. As he rightly mentioned, he treated that case. Even I don't know that he treated that case. I'm surprised because most of the children now Vivek is treating better than me. So he is addressing the root cause. He is entering into the root cause, he analyzing that now we have to develop this lab in such a way. So he is bringing the new innovations into Shwasa hospital. Actually, I was burdened with the practice and practice. Now he is concentrating on the development of this thing. And now I am mainly focused on the Shwasa Foundation, where our philosophy, at least my philosophy, treat one, aware all. Treat one. This is the concept. Shwasa Hospital is for treatment. Shwasa Foundation is for awareness. I give examples in the social media also. If anybody falls in the well, you have to take him out. There you don't talk about the prevention. First you take him out. That is the duty of the hospital. If he is repeatedly falling in the well, it is a nonsense. Then we have to give the foundation. You have to build the parapet wall, not to fall into the well. That is more important. That is what I strongly believe in. With this remarks, I want to invite Sirisha Raghavendra as a special invitee. Madam, please come and give your few words.
It's my absolute privilege to be amidst all of you. You are such a proven persons and you have achieved a lot of heights, and we are just to follow you. We are here just to follow you. So thanks for inspiring all of us. And it's really privilege for me to be alongside the Dr. Vishnu sir. And at this point of time, I humbly remember my elders, my parents, my grandparents, my teachers, and who really inculcated in us when we were students, who really inculcated in us the greatness of doctors. We were told by all the elders at family and school, college, whatever you say, that doctors are living gods. And all this was theory to us, because we never get to see what actually is a living God. But with doctors like Vishnu Rao sir and many more among you, and likewise, we are getting to see how they actually operate, why they are called living gods. With all due respect to all the doctors and administrators present here, you have been making the world better and better by treating the needy who cannot be treated otherwise, who cannot be made normal otherwise. There's so many problems for every human, may it be the revenue issue, may it be the police issue, may it be any court issue, everything. But to actually talk, to actually stand, to actually sleep, to actually breathe, doctor is the first responder, and that is the reason no police, no advocate, not any profession are called living gods, but doctors, because they make us actually to breathe and live properly. Being IPS or that, to keep apart, I am we as a family are one of the most beneficiaries of Shwasa Hospital, and I proudly say that Dr. Vishnu Rao sir and Dr. Vivek has treated my father and my mother-in-law, and who have really stopped getting hospitalized. I am not exaggerating when I say that, but before that it was too bad. I mean, their situation, they were having this asthma attacks and all. The situation was too bad. But after coming to Swasa hospital, doctors, I mean, sir treated them so well, not just with the medicines, but with the psychology, as he has been, telling all through. So, sir, after seeing your presentation, I just, what all we might have learned when we were kid, I just remember one thing: united we stand, divided we fall. Though we are specialists in our own arena, when we all come together, definitely we can make a society much better. I can relate, I am sure, sir, from I can assure on everybody's behalf that this is going to be a huge success, because I was one of the part in making such similar kind of innovation in the police department, where uh, a POXO victim, I mean, child sexual abuse victim, may it be a girl or boy below 14 years. So, when they were sexually abused, so we as a police department were actually supposed to only file the FIR and then investigate who's accused, and then arrest him and then charge sheet in the court. That's all. But with this kind of idea, what we have done the all interdepartmental coordination with the revenue persons, with the police, with the psychologist, with the court, everything. All of us have coordinated together and came under one roof, which is called Bharosa Center in the Hyderabad, and it is first of its kind innovation in the entire country, which is being replicated across the states, including Gujarat, Kerala, and all. Because every sexual abuse victim, it is highly impossible for them to open up what exactly happened with them. And after coming out of the trauma itself is very difficult, and coming out of the trauma and going to the police station, which is usually a, nobody wants to go to the police station, right? So coming to the police station and report to the male officers there what exactly happened with them, and after that going to the court, which again so many accused will be there along with handcuffs and all in other murder cases and all. So that environment will definitely be a different thing, and it is even more traumatic. So the victim used to run pillar to post earlier. I mean, they used to go, and we used to take them to the government hospitals like Nilofer hospitals and all. Again, because a victim herself or himself knows, whenever you're seeing, I mean, during that trauma period, whenever they get to see any person, they think that, he is also kind of accused. So whenever they get to go to, government hospitals, courts, then police stations, then everything, so it was even more traumatic for them. But as like sir said, we all have to come together under one roof, so that, including, I mean, court was also impressed with this idea, and High Court has given separate court for the POXO victims. Everything is under one premises, so that they need not go anywhere. And above all, as we are humans, and we have to treat first, on humanitarian basis. So first, as soon as they come, so we treat them with a clinical psychologist, so that first that they have to be normal, then the treatment start. Likewise, Vishnu sir, whenever someone comes to him, first he says that, just as a family friend, or as a elder in the family, he talks to them, and he gets so much out of them that their entire venting out is done. So then he starts treating. I have observed him so closely. So usually they observe watch, including we police officers. So whenever we talk to the petitioners, we see that so many are outside, so we get to close. No, that is not done in Shwasa hospital, as far as I have seen, and I am sure this is done for everyone, because I've heard from many people. So first, sir asks us to speak so much. So what all you have, you will talk, you will spit it out. Then sir thinks on the 360-degree angle, and then his treatment starts.
It's my privilege to be standing in front of you. I know sir for more than 2 decades, and 2 decades back, whenever a child was diagnosed as asthma, we used to refer to sir for counseling first, because those days inhaler therapy was though the gold standard therapy. It was always thought that it is an addictive medicine, and it becomes habit forming, and also many parents never used to start on inhaler therapy. So we used to send it to sir. Sir used to take counseling sessions for 45 minutes to 1 hour and then convince them and have a regular follow up. So those were the days more than 2 decades back when inhaler therapy started being used by introduced, and counseling was so good that they used to stick to it, and majority of them used to come out of that problem as they grow. And the presently the Dohard hypothesis of developmental origins of health and disease also indicates that the fetal origin in the microbiome, which changing microbiome, which has an effect on the health and disease. So his concept of ideas takes it forward, and I would like to congratulate and wish you all the success for Vivek. And we know sir for more than 2 decades, and with a concept of the united, as madam was saying, we work together, then you take it forward, and it is a whole, I should say, holistic health. You look at holistic health, and of late we are seeing that there is a change in trend from infectious diseases to non-communicable diseases, which is going to see in the next 2 decades, or in by 2040 to 2050. You see earlier, about 4-5 decades back, we used to look at pneumonia and diarrheas deaths, but the mortality now is more on the rise because of the ultra processed foods and junk foods and all that, which is also changing the gut microbiome. So I think the psychological disorders also have been on the rise, and this definitely the ideas will take care of the holistic health. And so all the best, Dr. Vivek, and with sir's guidance, I think everything will be. He is the guiding force to all of us when we were juniors, and for you, definitely, sir will be there as supportive and holistic health. And thank you very much for the opportunity and all this.
Inhalation therapy she talked about. When I started in Naradshal and Miryalgoda inhalation therapy, patient used to fight with me. Why are you writing this addictive medicine? Then, luckily, I like Telugu language very much, and this my indebted this thing is gratitude for my teachers. అంటే మెడికల్ నాలెడ్జ్ని కామన్ మ్యాన్కి తీసుకోవటం ఎలా అనే దాని మీద నేను పరిపూర్ణంగా అందులో వాళ్ళకి ఎగ్జాంపుల్స్తో సహా చెప్పేవాడిని. సో ఎప్పుడైతే ఎగ్జాంపుల్స్తో మనం చెప్తామో వాళ్ళు మెల్లమెల్లగా ఒక్క ట్యాబ్లెట్ని 1000 ముక్కలు చేస్తే ఒక్క ముక్కతో ఒక్క పఫ్ తయారవుతుంది. ఒక్క ట్యాబ్లెట్ని నువ్వు 1 year వాడినట్లు. నీకు ఈ ట్యాబ్లెట్లు రోజు 2 పూటలు కావాలా? ఈ ఒక్క ట్యాబ్లెట్ని 1000 ముక్కలు చేసినటువంటి ఈ ఇన్హేలరు దాదాపు సంవత్సరం పాటు వస్తుంది. ఇది కావాలన్నా అంటే, సార్ అదే కావాలి సార్. దిస్ ఈజ్ ఆల్ కౌన్సిలింగ్. అందుకనే మన పేషెంట్లు వినరు అనుకుంటాం, కానీ మనం కరెక్ట్ చెప్తే వింటారు. సో వాళ్ళకి అర్థమయ్యేటట్టు చెప్పాలి అంతే. అయితే అర్థమయ్యేటట్టు చెప్పడం అంటే ఏంటంటే వాళ్ళ భాషలోకి పోయి చెప్పాలి, వాళ్ళ ఫీల్డ్లోకి వెళ్ళాలి, వాళ్ళ దాంట్లోకి వెళ్ళాలి, అప్పుడే చెప్తుంది. సో సార్ వాంట్ టు టాక్, హీఈస్ రైజింగ్ ద హ్యాండ్ అండ్ యూ వాంట్ టు షేర్ హిజ్ views.
I am Dr. Jayasundar, ophthalmologist. I am very much impressed by the talk of Dr. Vishnu Rao. I think he is the best speaker on the subject of allergy for this year, I can say proudly. And I am not praising you, sir, because I see your lectures on the TV regularly. They are very, very impressive. And my small doubt regarding, as I am an ophthalmologist, somebody told rubbing of the eyes causes keratoconus. What treatment do you like to give? Is it anti-allergic treatment or surgery for keratoconus?
Rubbing, the cornea becomes so thin and it herniates, keratoconus. Our idea here is, what is the treatment? Once it bulges out, you have to correct it by surgery, no doubt about it. If the same ophthalmologist postgraduates knows about the allergy, when the patient comes to him, sir, my eyes are itching, he can prevent the keratoconus. That is our idea here. So how to prevent it? Even after treating the keratoconus with surgery, even treating sinusitis after surgery, or tonsils after surgery or adenitis after surgery. There is no surgery for the allergy. Allergy has to be treated, addressed at the root by the immunotherapy or anti-allergic treatment. This is what we strongly believe in at Shwasa. And most of the things we avoid the surgeries for the people generally, and that is giving wonderful results where patients comes and tells. Our idea is preventive medicine. So treat one, aware all is the concept. Thank you so much for coming. Now the final thing is coming. I invite all the dignitaries to come onto the dais for the logo launch. Thank you so much.
పిల్లల వైద్యుల అధ్యక్షుడిని మాట్లాడుతున్నాను. ఈరోజు చాలా శుభకరమైన దినం. ఎందుకంటే నా స్నేహితుడు డాక్టర్ విష్ణురావు గత 30 సంవత్సరాలుగా ఈ అలర్జీ వ్యాధులతో సఫర్ అవుతున్న పిల్లల్ని, పెద్దల్ని ట్రీట్ చేస్తూ ఈరోజు తను ఒక ఫౌండేషన్ కూడా స్టార్ట్ చేశారు. అదే శ్వాస ఫౌండేషన్. ఈ శ్వాస ఫౌండేషన్ ద్వారా ఈ యొక్క ఏదైతే ఈ అలర్జీ జబ్బుల యొక్క విషయాలు, వార్తలు కామన్ ప్రజలకు కూడా అందజేయాలనే ఉద్దేశంతో, అందరినీ అవేర్ చేయాలనే ఉద్దేశంతో శ్వాస ఫౌండేషన్ స్టార్ట్ చేశారు. ఇతను వచ్చాక హైదరాబాద్లో ఎంతోమంది పిల్లలకు, పెద్దలకు ఈ అలర్జీ వ్యాధుల నుంచి విముక్తిని ఇవ్వగలిగారు.
ఈరోజు మేము ఐడియాస్ అనేటటువంటి ఒక ప్రోగ్రామ్ని స్టార్ట్ చేస్తున్నాం. ఇంటర్ డిసిప్లినరీ ఇంటరాక్టివ్ ఎలర్జీ సొల్యూషన్స్ అనేది అంటే ఎలర్జీకి సంబంధించినటువంటి వైద్యానికి సంబంధించింది. అంటే ట్రీట్ ద రూట్, నాట్ ద ఫ్రూట్. అంటే ఎలర్జీ అంటే మనందరికీ తెలుసు, ఏదో ఒకటి పడకపోవటం. అది దుమ్ము కావచ్చు, పోలన్స్ కావచ్చు, పొగ కావచ్చు, వాతావరణం కావచ్చు, కూల్ డ్రింక్ కావచ్చు, ఐస్ క్రీమ్ కావచ్చు, ఫుడ్ కావచ్చు, ఏదైనా సరే ఏదో ఒకటి పడకపోవటాన్ని ఎలర్జీ అంటాం. ఈ ఎలర్జీ అనేది చిన్న పిల్లల్లోనే మొదలవుతుంది. చిన్నగా మొలకెత్తుతుంది చిన్నపిల్లల్లో. అది ముక్కు దిబ్బడిలాగా, ముక్కు ఎలర్జీ లాగా, తర్వాత నేసల్ బ్లాక్ లాగా, అదే సైనసైటిస్గా మారుతుంది. అదే కళ్ళల్లో దురదగా, అదే ఎడినాయిడ్స్గా, అదే టాన్సిల్స్గా, అదే ఆస్తమాగా, తర్వాత ఆ ప్రాబ్లమే డెర్మటాలజీగా, ఈ ప్రాబ్లమే తర్వాత గ్యాస్ట్రో ఇంటెస్టైనల్గా అంటే జిఐటీలో కూడా కొంతమందికి ఫుడ్ పడకపోవడం వల్ల వాంతులు అవ్వటం, విరోచనాలు అవ్వటం, మాటికి బ్లోటింగ్ రావటం, టేపులు రావటం, కడుపులో నొప్పి రావటం, కొంతమందికి జాయింట్స్ ఇదే ఉంటాం, కొంతమందికి మైగ్రేన్ హెడేక్స్ ఉంటాయి. ఇవన్నీ కూడా అంటే అలర్జీ అనేది అన్ని స్పెషాలిటీస్ని టచ్ చేస్తుంది. అది ఈఎన్టీ కావచ్చు, ఆఫ్థమాలజీ కావచ్చు, న్యూరాలజీ కావచ్చు, సైకాలజీ, సైకియాట్రీ, దాని తర్వాత పల్మనాలజీ, డర్మటాలజీ, తర్వాత గ్యాస్ట్రో ఎంటరాలజీ, తర్వాత రిమటాలజీ, అన్ని విభాగాల్లోకి కూడా ఈ అలర్జీ అనేది ఎంటర్ అవుతుంది. అంటే ఈ అలర్జీని ఒక్కొక్కళ్ళు ఒక్క పీస్ ఆఫ్ పజిల్ని పట్టుకొని ఉన్నారు. అన్ని పజిల్స్ని ఒక్క ప్లాట్ఫామ్కి తీసుకొచ్చి ఒక ఎలర్జీ పేషెంట్కి మొత్తం సమూలంగా వైద్యాన్ని చేయటం ఎలా, కళ్ళల్లో ఉన్న, ముక్కులో ఉన్న, చర్మంలో ఉన్న, పేగుల్లో ఉన్న ఈ అన్ని అలర్జీని అడ్రస్ చేయటం ఎట్లా అనేటటువంటి దానికోసం ఐడియాస్ అనేటటువంటి ఒక ప్లాట్ఫామ్ని ఇది నిర్మించటం జరిగింది. దీని ద్వారా ఎవరైతే కొత్తగా పోస్ట్ గ్రాడ్యుయేట్స్ వస్తున్నారో, మెడికల్ స్టూడెంట్స్ ఉన్నారో, యంగ్ డాక్టర్స్ ప్రాక్టీస్లోకి ఎంటర్ అవుతున్నారో వాళ్ళందరికీ ఈ అలర్జీ గురించి కానీ, ఈ ఆస్తమా గురించి కానీ, ఈ జబ్బు ఎన్ని ఆర్గాన్స్లో ప్రజెంట్ చేస్తుంది, తర్వాత ఏ వయసులో అంటే చిన్నపిల్లల్లో మొదలైనటువంటి ఎలర్జీ ఆస్తమా పెద్దవాళ్ళ వరకు ఏ విధంగా ప్రయాణం చేస్తుంది, దానికి ఏ విధమైనటువంటి వైద్యం చేయాలి, ఏ విధమైనటువంటి వైద్య పరీక్షలు చేయాలి, ఏ విధమైనటువంటి ట్రీట్మెంట్ చేయాలి, మొత్తం మీద వాళ్ళ అలర్జీని కానీ, ఆస్తమాని కానీ, వాళ్ళ సైనస్ని కానీ, హెడేక్స్ని కానీ, కళ్ళ దురదలు కానీ, ఒళ్ళు దురదలు కానీ, లేకపోతే ఈ పేగుల్లో ఉన్నటువంటి అలర్జీని కానీ ట్రీట్ చేయటం ఎలా. ఇది శ్వాస హాస్పిటల్, శ్వాస ఫౌండేషన్ సంయుక్త ఆధ్వర్యంలో ఈ ప్రోగ్రామ్ని మొట్టమొదటిసారిగా దేశంలో మొదలుపెట్టడం అనేది జరిగింది. దీనికి ఐపీఎస్ శిరీష రాఘవేంద్ర గారు ముఖ్య అతిథులుగా విచ్చేశారు. దాని తర్వాత పీడియాట్రిక్ రాష్ట్ర అధ్యక్షులు డాక్టర్ భాస్కర్, తర్వాత ఇన్కమింగ్ రాష్ట్ర అధ్యక్షులు డాక్టర్ జి విజయ్ కుమార్ గారు, దాని తర్వాత ఈఎన్టీ స్పెషలిస్టులు, ఆఫ్థమాలజిస్టులు, గ్యాస్ట్రో ఎంటరాలజిస్టులు, అన్ని రంగాలకు సంబంధించినటువంటి స్పెషలిస్టులు ఈరోజు రావడం జరిగింది. వాళ్ళ యొక్క అనుభవాల్ని కూడా షేర్ చేసుకోవడం అనేది జరిగింది. కాబట్టి ఈ ఐడియాస్ని మేము నేషనల్ ప్రోగ్రామ్ 2026లో అన్ని సిస్టమ్స్ని ఉపయోగించి ఈ యొక్క ప్రోగ్రామ్ నేషనల్ లెవెల్కి తీసుకోవాలనేది మా యొక్క ఉద్దేశం. దీనికి సంబంధించి ఇక్కడికి వచ్చినటువంటి ప్రతి ఒక్కరికి కూడా అభినందనలు తెలియజేస్తూ మా కృతజ్ఞతలు తెలియజేస్తాం. థ్యాంక్ యూ సో మచ్.
ప్లాట్ఫామ్ని లాంచ్ చేయడం జరిగింది. మీరు చూడొచ్చు ఇక్కడ ట్రీట్ ద రూట్ నాట్ ద ఫ్రూట్ అని ఇచ్చాము. దీని మీనింగ్ ఏంటి అంటే ఎలర్జీ అనేది దాన్ని మొదల్లోనే ట్రీట్ చేయాలి. ఫ్యూచర్లో దానివల్ల వచ్చే కాన్సిక్వెన్సెస్ని కాకుండా ఆ ఎలర్జీ ఎక్కడ మొదలవుతుంది దాన్ని పసిగట్టి దాని ప్రకారం దాన్ని స్పెసిఫిక్గా ట్రీట్ చేస్తే ఎలర్జీని ఇంతకుముందులాగా ఇప్పటికీ క్యూర్ చేయలేము అని చాలామంది అంటుంటారు. బట్ చాలా ఎలర్జీస్ని ఇప్పుడు క్యూర్ చేయగలిగే ట్రీట్మెంట్స్ కూడా వచ్చాయి. దాన్నే ఎలర్జీ అని ఇమ్యూనోథెరపీ అంటాం. ఈ ఎలర్జీ అనేది ఒక భాగం కాదు, మన శరీరంలో అన్ని భాగాల్ని కూడా ఎఫెక్ట్ చేయగలుగుతుంది. అది కళ్ళు కావచ్చు, ముక్కు కావచ్చు, సైనసెస్, లంగ్స్కి వస్తే దాన్నే ఆస్తమా అంటాం. అంటే ఎలర్జీ కానీ ఆస్తమా కూడా ఉంటుంది, బట్ ఎలర్జీ వల్ల వచ్చే ఆస్తమానే ఎక్కువ, ఒక 60% వరకు. వీటన్నిటినీ కూడా కరెక్ట్ టైంలో ఐడెంటిఫై చేస్తే దాన్ని ట్రీట్ చేయొచ్చు. అదేవిధంగా ఆ పేషెంట్కి సైనసైటిస్ ఉండొచ్చు, గ్యాస్ట్రైటిస్ అంటే ఎసిడిటీ అనే ప్రాబ్లం ఉండొచ్చు. వీటన్నిటిని కూడా దృష్టిలో పెట్టుకొని ట్రీట్ చేసినట్టయితే కనుక పేషెంట్కి బెస్ట్ రిజల్ట్స్ వస్తాయి. ఇప్పుడు ఈ ఐడియాస్ అనే ప్లాట్ఫామ్ వచ్చే యంగ్ డాక్టర్స్కి ఈ ఎలర్జీ అనేది ఒక చెట్టు కొమ్మల్లాగా ఎన్నో రకాల బ్రాంచెస్లో ప్రజెంట్ అవుతుంది. ప్రతిదాన్ని కూడా మనం ఒక సిస్టమిక్ డిసీజ్ లాగా చూడాలి. ఏదో చర్మం మీద ఉంది మచ్చలు అంటే చర్మంలో జబ్బనే కాదు, ఆ జబ్బు యొక్క మూల కారణం తన బాడీలో ఉన్న ఇమ్యూన్ సిస్టంలో ఉంటుందని గమనించాలి. అది చెప్పడమే ఈ ఐడియాస్ యొక్క ప్రథమ ఉద్దేశము. ఈ విధంగా ఈరోజు లాంచ్ చేయడం జరిగింది. మనం నేషనల్ కాన్ఫరెన్స్ కూడా చేయబోతున్నాం నెక్స్ట్ ఇయర్. దట్ ఈ అవేర్నెస్ అనేది మరింతగా దాన్ని స్ప్రెడ్ చేయాలి. అండ్ మెడికల్ ఫ్రెటర్నిటీయే కాకుండా మీడియా మిత్రుల సహకారం ద్వారా చాలామంది కామన్ పబ్లిక్కి కూడా ఎలర్జీ అనేది ఇంతకు ముందులా కాదు, పెరుగుతుంది, చాలామందికి ఉంది. ఇంకా ఒక పర్సన్కి ఉన్నప్పుడు ఇంకా పెరగకుండా దానికి మంచి ట్రీట్మెంట్ ఆప్షన్స్ కూడా ఉన్నాయని తెలియజేయడమే మా శ్వాస ఫౌండేషన్ యొక్క ప్రథమ ఉద్దేశం. ఈ ప్రోగ్రామ్కి వచ్చేసిన పెద్దవాళ్ళందరికీ కూడా ధన్యవాదాలు. అదేవిధంగా వచ్చిన మీడియా అండ్ ప్రింట్ మిత్రులకు కూడా ధన్యవాదాలు. థ్యాంక్ యూ.
నేను ఏంటి సర్జన్. శ్వాస ఫౌండేషన్ నుంచి నేను ఒక 2-3 ఇయర్స్ నుంచి అసోసియేటెడ్ ఉన్నాను. ద వెరీ ఐడియా ఆఫ్ ఐడియాస్ ఈజ్ ఇట్ ఈస్ లైక్ అన్ని స్పెషాలిటీస్ కలిపి సార్ ఒక హోలిస్టిక్ అప్రోచ్ టు అలర్జీ. అంటే ఈఎన్టీ పరంగా చూసుకుంటే అలర్జిక్ రైనైటిస్ కానీ సైనసైటిస్ కానీ, అది ఒక ఈఎన్టీ ఆస్పెక్ట్ నుంచి చూడకుండా ఒక జనరల్ ఆస్పెక్ట్ లాగా అంటే హోలిస్టిక్ అప్రోచ్తో ట్రీట్మెంట్ చేయడం అనేది ఇట్స్ ఎ గ్రేట్ ఐడియా ఇనిషియేటెడ్ బై డాక్టర్ విష్ణు సార్ అండ్ శ్వాస ఫౌండేషన్. అండ్ థ్యాంక్ యూ వెరీ మచ్ ఫర్ ఇన్వైటింగ్ మీ. థ్యాంక్ యూ.